If you suffer with arthritis in your hands and fingers, chances are you've been told that nothing can be done. But the truth is, with a few carefully selected exercises and some consistency, it's possible to improve the symptoms of your arthritis so you can use your hands again with much less pain. My name is Will Harlow and I'm the Over-Fifties Specialist Physio here at HT Physio in Farnham. And today I'm going to be revealing my favourite exercises to help people over 50 to improve the function of their hands and fingers even if they've got arthritis. Now, osteoarthritis in the fingers is really common and it's categorized by a loss of cartilage between the tiny little joints in the fingers. Now, our fingers have got lots of little joints inside them and our hands have as well, which means there are a lot of places that can be affected by arthritis. Now, even though this condition can't be cured, with the right approach, we can improve the symptoms and make the use of your hand a lot easier. There are two principles we need to follow today. The first principle is that movement is generally helpful for arthritis. It kind of oils the joints and makes the remaining cartilage healthier. And this second principle is that strength in the muscles that control your hands are also going to improve the function of your hands and may reduce pain as well. Okay, so we're going to do some exercises now to help you improve the symptoms of hand and finger arthritis. Before I show you them, just know that they're not going to be suitable for everyone. So do get checked out before you give them a try. And if they cause you any pain, just avoid them. The first thing we're going to do is mobilize the small joints of your fingers. And if you look at my hand here, I've got a distal joint, so this tiny little joint at the end. I've also got a middle joint here, and then I've got what we call a metacarpophalangeal joint here, which is like your knuckles, okay? So we've got 3 joints on our long fingers, and we've got 2 joints here on our thumb. So what we're going to do, I'm going to start with this finger here, which is my forefinger. You're going to put the thumb of your opposite hand underneath the second bone of your finger and your other finger on top like this. And then you're just going to use that pressure there to push down at the end of the finger, pushing that joint into what we call flexion. And you're going to try and do this repeatedly. So the hand that's being worked is actually fully relaxed, and it's this one here that's doing the job. Now, I'd recommend probably doing 10 or 15 of those in a row, and then you're going to move down, and you're going to put your thumb underneath that final joint, that final bone there in the finger, and then the other finger comes on top there and then mobilizes this one. So then we're moving the finger down like that, bending that finger, especially if you've got stiffness in these joints. This is a fantastic way to just get them moving a little bit better. And once you've done 10 there, you're going to move down one more time. So now your thumb is going to come underneath what we call the metacarpal, which is this space between the thumb and the forefinger here. You've got a bone underneath here called your metacarpal. Then this finger is going to come on top of the proximal phalanx, and then we're just going to push down on this joint. And that means the knuckle joint now is moving into flexion. Now, once you've done that with your forefinger, of course, if you've got stiffness in the other fingers, you're going to move along. So you would do exactly the same thing, but this time we're going to do it with your middle finger. And then once you've done a number of those, 10 or 15 is great. You're going to move down and do another 10 or 15 here, and then move down one more time. And now you're doing your knuckle joint. Obviously, you can do that on the other side as well. When it comes to the thumb, it's exactly the same. You're just going to support your thumb with your opposite thumb there, and then the finger's going to come down on top and just help to mobilize it like that. Now, if you can do a couple of sets of that, that would be really good. And then the next thing you can do is you can do the opposite. So this time you're going to take your finger underneath the end joint and your thumb is going to go on top, and you're just going to gently bend it back into what we call extension, which is the opposite movement to what we just did. The first one was flexion, now we're doing extension. And you can do that with each joint here in the hand as well. So we've got the distal phalanx being pushed up into extension here. Then we're going to move one down, so we're working the middle one, and then we can move one down and work the knuckle joint like that. Obviously, use that exercise throughout your whole hand for best results. And I would try and do that a couple of times a day, maybe dedicating 5 minutes each time you do it. So once we've done that, the next thing we're going to work on is something called opposition. And opposition is this pincer movement of the movement between your thumb and your fingers. And you can do opposition of any of your digits. Now, if you've got hand and finger arthritis, you might find that you're quite weak when you do a pincer grip. You can't hold it for long, or one of the fingers feels like it's going to buckle. And if that's the case, some strengthening can definitely help. So this is what we're going to do. You're going to have your hand rested on something like this, and all you're going to do there is pinch your thumb and your forefinger together and squeeze. And hold that contraction for 5 seconds. Then relax and move on to the next finger. So now I'm going to do thumb and middle finger, hold and squeeze, hold for 5, and then go to the fourth finger, hold and squeeze. You can see that one's a bit weaker on me. And then we go to the pinky and hold and squeeze that contraction. Then you can work your way back. So go back to number 4, hold and squeeze, then back to number 3, hold and squeeze, then back to number 1. Now this exercise is actually really nice to do underneath the warm water. So I would run a basin full of water, so like nice and warm, okay? Plunge your hand into it and then do this exercise. It's a super tip to help you get a little bit more out of this exercise, because warming the joints up is really helpful for arthritis. And again, if you can do that a couple of minutes per day, you're going to end up increasing your pincer grip, which is going to improve the function of your hand. Before we go any further, I just want to tell you about 3-Tip Friday. 3-Tip Friday is my weekly email that I send out to my list, and it features 3 of the most interesting things I found that week. It could be a health tip, it could be a piece of research I'm reading, or it could be a new tool that I've found to be really useful for helping people get more mobile. It's totally free. I just send it out once a week. There's no annoying promos inside, and you can sign up for it by going down below this video and entering your email in the 3-Tip Friday link. Now, the next thing we're going to do is improve your grip strength, because if you're anything like most people who have this condition, you'll have noticed over time your grip has started to decline. But the good news is we can retrain grip and build that strength back up. So what we're going to do here is use a towel. You just want a standard towel. It can be a hand towel or a bath towel, no problem at all, whatever you choose. You're going to fold it over into a couple of folds like this. So you've got a nice thick area of the towel, and then you're going to grasp an edge, holding as much of the towel as you can, and then grip. Squeeze as hard as you can, paying real attention to try and dig all 4 fingers and your thumb into the towel. Now, what I would recommend you do here is start off by holding for 10 whole seconds. So hold that contraction for 10. You might notice a little bit of shaking as you do that. That's absolutely fine. That's kind of what we want. And then relax. You might repeat that 5 times in a row, which will really help to get your gripping muscles working beautifully. Now, if you've finished that, what I'd recommend as the next thing is, instead of holding for 10, is to do exactly the same thing, but this time fast grip and release. It looks something like this. So you go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then pause. And what you'll feel here is the same kind of muscle burn, but it will be kind of different. It will feel like almost a different part of the muscle. And what we're practicing here when we do the grip and release is we're also practicing our release technique, which can become more difficult with arthritis as well. So I'd recommend doing that a couple of times per day. Have a towel next to your sofa or the chair that you like to sit in. When you're reading the paper or watching the TV, it's a really nice thing to do to make sure you don't lose any grip. The next thing we're going to do is improve the strength and mobility of your extension, which is this, opening the hand back up. Now, just as a side note, before I show you the exercise, if you're enjoying this routine, I've got tons more follow along with me exercise routines in my lifelong mobility program, and you can find a link to that in the description box to this video. Anyway, let's have a look at extension. So what we're going to need for this is a rubber band. It can be a band of just about any size, because if you've got a big one like me, you can flip it over, double it up. And what we want to do here is wrap it around all of our fingers and the thumb as well. Now, once it's in this position, we're very simply just going to try and open all of our fingers and the thumb into the band, hold that position for a couple of seconds, and then just let it come back in like that. Very simple. So opening up into the band, making sure we're doing all 4 fingers. Some of your fingers might lag behind. For me, it's my middle and 4th finger that are having a hard time with this, so I'm paying special attention to making sure they are not slacking. I'm just going to turn my hand over in case you can see it better. So you can open up like this, hold for a few seconds, and then relax. Now, this shouldn't put any stress on your joints, but you will feel it in the tiny little muscles all around your hand. You'll probably feel it in places you didn't even know existed. And that is a really good thing because we're building strength in those areas that we actually use every day without realizing. Now, I'd recommend, again, maybe doing 10 of those in a row, a couple of times per day if you're serious about improving your hand strength. And that's going to go a long way to improving the strength of your muscles and your joints as well. The final exercise we're going to do for your hands today is called adduction and abduction, which looks kind of similar to opening and closing the hand, but with a slight difference. So here's how it looks. I'm going to show you up here first, and then I'll put my hand down on the table. So what we're going to do essentially is have our hand flat like this. We're going to open the fingers up as if to make as big a gap as possible between them, and then we're going to squeeze that gap shut as tightly as we can. I'm going to put my hand down here to show you again. So we're going to slide those fingers apart and open the hand up and then squeeze them together. So we're not making a fist. We're bringing our straight fingers all together to squeeze as tight as we can. Something that's quite nice to imagine is imagine someone's just slipped a piece of paper between your fingers and you're trying to grab that paper and stop them from pulling it out like this. And what we're going to do here again is open, hold for 3 seconds this time, and then close, hold for 3 seconds again. So this is purely a strength movement for your adductor and abductor finger muscles, the tiny little muscles that live inside the hand. And it will also help with your mobility, because if you're struggling to open your hand to receive objects when you're past them, this can really help too. So again, I'll do 10 in a row, 3 seconds each time, and then 3 or 4 times per day is a great kind of routine to get into for this kind of thing. And if you're serious about improving the function of your hands, those little exercises are all you need. So those are some of the best exercises to help you strengthen your hands and fingers and stave off the symptoms of arthritis. I hope you found this video useful. We made this video because many of you asked us to make it. So if you enjoyed it, do drop a comment below and just let us know whether we've achieved our goal of helping you today. Anyway, if you want to get more exercises just like the ones that I showed you in today's video, I've got tons more in my brand new book, Thriving Beyond 50, the 2024 edition. It's got over 100 exercises inside, perfect for people over 50. And you can find your copy by going down below this video and finding the link in the description box. Anyway, thank you so much for watching. I really appreciate your time, and I'll speak to you again on the next video.